Welcome to the Connection Podcast, presented by the Yuma Cares Coalition, where voices from prevention and mental health come together to inform, educate, and strengthen our community.
Hello, everyone. Welcome back to the Connection Podcast. I'm Jenny LeGros from Yuma Cares Coalition, and here with me today is the ever popular Henry Gonzalez. Welcome.
Yes. Thank you. Thanks for having me. Yeah, good to be here. Back again.
I know, back again.
Well,
so I was thinking about all of the things that we were going to talk about and questions that I was going to ask you and things like that. And I thought maybe we would just kind of take a look back at number one. You were able to present to our coalition here back in March, just a few weeks ago. And you were also a guest on the podcast last year.
Absolutely.
I know that there has been quite a bit of progress since there. Some things have stayed the same, some things have changed. So why don't you just kind of share what's been going on with you?
Yeah, so again, thanks for having me. And you're right, I was here, gosh, it was at least a year ago. And I think the focus, Ms. Spicer interviewed me then. And I think the focus there was just kind of talking about, substance abuse and my involvement with the coalition, going back to my work, juvenile court days, to my transition now at the high school district. And so I really appreciate the opportunity to come and talk now about, it was substance abuse then, but it's mental health now. And I think we can all agree that those are what we consider co-occurring disorders, right? Oftentimes when you have the substance abuse piece was oftentimes a byproduct of mental health. And that was my experience, working in the juvenile justice system for a number of years. And now, as I transitioned over to working with the Yuma Union High School District as the Director of Health and Safety, I am so very proud that we have services in place for our youth, for our students, that not only address substance abuse, but also the mental health piece. And I am equally proud of our community and the Yuma County Anti-Drug Coalition, the Yuma County Mental Health Coalition, who recognize that, gosh, we need those services, right? We need those community members to come together. And I'm sure I said this a year ago, and I'll say it again, is that substance abuse and mental health is not an isolated issue, right? It's not an issue exclusively for our mental health community or our fire department or our first responders, law enforcement, or the school system, or just parents alone. It's a problem that we all as a community must face together, and that's what the Yuma County Anti-Drug Coalition, the Yuma County Mental Health Coalition, Yuma Cares has done for our community, is bring all of those folks together so that we can create a united front and address our community's needs together, uniformly.
Right. It really does affect all of us. And so I know, too, just also coming from the Yuma Union High School District, years ago, we did not have your position as Health and Safety Director. And you shared also a personal story about you in high school experiencing, a moment where mental health was going to be mental health strategies, coping mechanisms, help was going to be needed for you.
Absolutely.
And it wasn't there at that time. And so now there's a big difference in how we handle things.
Yeah, we definitely made a progression.
Do you want to share a little bit more about that?
We have absolutely made progression. And what I shared was my, like you said, my own story, my own experience. And this, we go back to 1996, 97, and playing football in high school, those were some of the greatest days of my life, right? As a kid growing up here in Yuma. And these were guys that, I had played in junior high and then high school. So as you can imagine, when you're practicing, when you're, hanging out with each other, you develop a very strong bond, as friends. And these are guys that I are still my best friends today, guys that I continue to talk to. And even though these guys are all throughout the United States, we're still brothers. And that bond was created at an early age. But just as we had this significant bond that was created from playing sports, playing football together, It was also a time where I experienced, we all experienced as 16, 17-year-old young men, experienced loss. And that was a really good friend of ours, a teammate, a brother, lost his life. His name was DJ Carr, and he lost his life coming back from Arizona Western College, where he was taking classes. And what I spoke about at the coalition meeting was that I'll never forget that day when, we're out at the practice field, and you look up and you see our trainer and she's in tears, and then you see the coaches come together, and our practice was immediately stopped, and coach said, "Hey, everybody, come together, let's huddle up." And he said something to the effect of, I don't quite know how to say this, so I'm just going to say it, that DJ Carr just passed away. And when you receive that information as a 16, 17-year-old, it hits you like a ton of rocks, right? And during that time, I remember we were in disbelief, we were in shock, we were sad, we were hurting, and we ended up at the hospital, Yuma Regional at the time, and the lobby was just full of football players, and another student was also involved in that accident, who was a varsity volleyball player. So there was just a group of students that were hurting, and I remember looking around thinking, like, who's here to support us? Like, we didn't have pastors, we didn't have counselors or social workers or therapists. It was just us as kids doing the best we could in that moment to comfort each other. But I do remember at some point we were there, and Tori Borganon, who was a counselor at the time, I can't remember exactly where it was that she said these words, but she said to us, like, guys, you guys are strong, tough football players, but you guys, DJ was your friend and you guys loved him, and it's okay to grieve. It's okay to cry. Like, these are big football players that are trying to keep this tough guy persona, but she was like, it's okay. It's okay to cry. It's okay to grieve. Just love each other, care about each other. And that was very comforting. We didn't have that. And what I didn't share at the coalition meeting was that around that time, we lost DJ, who was a football player. We also lost another one of our teammates, Cecil Croft, lost his life in an accident, and then shortly thereafter, another one of our teammates, Philip Alvarez, passed away. So in a very short period of time, if I had to gauge it, I'd say 6 to 8 months, we lost 3 of our teammates. Yeah. And at 16, 17 years old, that was tremendous loss for us. And I can tell you that there was some crying, there was some grieving going on, and at that time where we were at, although I know that our teachers cared about us, Miss Tori Borganon as a counselor cared deeply for us, our school administration cared deeply for us. I don't recall having a social worker or a therapist or a counselor or anybody there giving us guidance and direction, not just in that moment, but thereafter. And so fast forward to where we're at now at the high school district, we now have, in addition to counselors, we have social workers at every single campus who are trained in mental health and crisis response. They are trained to identify and provide services and care for the needs of students. So in the event a young person experiences loss like we did all those years ago, we now have somebody that's there at the campus level that will be there for them and walk them through that process. And that's a tremendous transition from where we were in the mid 90s to where we're at now. In addition to the social workers, we have a relationship with several of our local mental health service providers, Easter Seals Blake Foundation, and Community Providers of Integrated Health. And Miss Courtney Starkey, who manages the school-based counseling services, was present with me, and we co-presented at the coalition, and she spoke about just the relationship that exists that we now have. And I'm proud to say, not just as the director of health and safety who cares about the overall wellness and health and safety of our students, but as a parent and as a community member to know that we've got services in place. We have people there at the campus level whose specific duties and responsibilities are to care for the mental health and the emotions of our students in the event something like that happens, a tragedy happens. And I can tell you it does in our community. We've got social workers that are there to provide that response to our kids. And I'm just so very happy that we have that.
And how would you say the coalition has really helped support that progress?
So like I said before, the coalition has been that conduit, that nexus that has brought everybody together. So at the presentation, I look out and I have a sea of folks. I've got folks that in the government sector. I've got business owners. I've got folks that are, involved in the treatment arena here locally. We've got folks from the hospital. We have folks from a number of different organizations and agencies within Yuma. Some of them are just parents, concerned parents, or business owners. We have faith-based organizations that are present. And so the coalition has brought all of those folks together. So when I stand up and present and I speak about my personal experience, but then I also speak to the services and resources that we have in place at the high school level, I'm able to communicate that out to that group of 60, 70, 80 people who then take that back to their respective organizations, and they inform their folks who are not only, their work at those organizations, but who are parents, who are moms and dads and grandmas and grandfathers. And it's comforting to know that although we have these services in place, it's been the coalition that has helped communicate that and spread that word and spread the information again, and just bringing everybody together. And that's again, going back to this belief that whether it's mental health or substance abuse, it's not an individual isolated event where one person or entity is responsible for providing that response. It's all of us together, and that's what the coalition offers every single month.
Right, and it's interesting what you said about the different sectors, and within each of the sectors that are represented, like each individual person does play multiple roles, like Absolutely. You said. They might be representing the police department, but yet again, they're a parent, right? And they might have a student that is also in the high school
part
district.
Of our community.
So that is what's really special, I think, about the coalition.
It is, and I love that. And again, it's networking, it's learning, it's resource sharing. It's bringing all of those folks together under one room so that we can really talk about mental health and substance abuse matters that affect us all, whether it's from a perspective of it being a school system or law enforcement or whatever. It's all of us together, and it's bringing us all together, and it's the coalition that's done that.
Nice. So is there anything also that you have going on right now with your social workers, with your nurses, that you would like to share that you have in the works for?
Yeah, absolutely. So again, we were so very thankful that our district and our leadership does a great job of recognizing the benefit of having not only the social workers and resources at the campus level to support our school administration, to support our counselors, to support our nurses together, SROs, so that they can address mental health and substance abuse together. But they've also recognized that, hey, there's some times where perhaps a social worker needs additional support, right, to provide the level of service that a young person might need. And so having the relationship with the local community providers, CPIH, Easter Seals, that's really been our school administration at the district level that has pushed to make sure that we've got funding in place to create those opportunities for students that perhaps need an additional level of service. And so that's only been something that's been in effect now for just a short period of time within the district. And then there's always professional development opportunities for our nurses and our social workers. Here just, tomorrow I'm taking a group of social workers and we're going to travel to Arizona State University for a professional learning development opportunity where those folks are continuing their level of education, right? So we're always learning. We want to make sure that we are in tune with the needs and current best practices and whatever it is that we can do to best support the students at our campus. And so it's a lot of work, right? It's a lot of work, and it's not, again, just any one individual, even at the campus level. You've got, it's a collection. It's a comprehensive response from the work that our administration does at the campus level, our school resource officers, again, having nurses, the social workers, the counselors, our security teams, all of those folks working together to create a safe environment for our students. So when they come to school, they feel safe, right? If they've got those mental health things going on in their life, little Johnny's struggling because he's having relationship issues, right? Everything to higher level needs. We've got people and services and resources in place that work together to make sure that kids are taken care of. And as a parent, that matters. As a parent,
Absolutely.
To know that when my son or daughter goes to school, that not only are they safe and they can be great students, they can learn, they can be athletes, but that they're also cared for in the event there's a tragedy. In the event life happens and there's a loss, like my experience was in the 90s, that there's somebody there to be there for them and comfort them. That's reassuring as a parent. And again, that's something that we're able to provide our community, and going back to the coalition, you guys make that happen.
That's
on
awesome.
a monthly basis.
That's awesome. Like you said, nothing is a one and done. It's a continuing process of trying to improve things and progress. So as we kind of come to a close, if you have one takeaway that you want the community to take away from this conversation, what would it be?
I would say, going back to my personal experience, again, we had administrators, we had teachers that cared about us in that moment. Our coaches cared about us, but we just didn't quite have the level of service that I feel that would have been best suited to support like we needed. We now have that. So I want parents, I want community members to know that in the event a tragedy occurs, whether it's in the community, off campus, we have services, people, and resources in place to provide for the needs of our kids. And I think that is tremendously important. It offers, again, reassurance, and it comforts parents. And I'm super happy to continue to work with the coalition, to work with my campus level and district level teams to always make sure that we're able to provide for our kids.
That's wonderful. Thank you, Henry, for always being our biggest cheerleader. I appreciate you so much. We appreciate you at the coalition so much. I want everybody to take this opportunity to thank you for watching and listening. Have a great day. Take care.
See you.
Thank you for joining us. You can find more information and resources on our website at ycadc.org. The Connection podcast is proudly sponsored by R.L. Jones Insurance.